Good evening to everybody. This project starts from a diagnostic problem regarding patients with disorders of consciousness. So this kind of patients goes from the coma to different stages with different levels of consciousness. And in the clinical practice, the gold standard to diagnose this kind of patients and understand what level of consciousness they have, it's the behavioral assessment, and especially the clinician asks them to do something, and they have to provide intentional movements or purposeful behavior that is assumed as a sign of consciousness preserved. But this is a problem because sometimes the most of these patients has a motor impairment, and maybe they have residuals of consciousness, but then they're not able to produce a purposeful behavior. So this leads to a high risk of misdiagnosis, and so we looked for a possible solution. This is to find a brain-based way to ascertain whether movement is spontaneous or intentional, and but of course, which movement should be used to validate this brain-based way? We choose the eye blink because it's one of the few movements that is preserved in the majority of this kind of patients, and also because we can test it in the healthy population, because it's one of the few movements that can be performed either spontaneously or voluntarily by healthy subjects. So, what we are looking for in the brain, we are looking for the readiness potential, that is a negative low cortical potential preceding voluntary movement execution. So, it was defined for limb movements like foot or hands, but not for the eye blink. So we have to validate it before the clinical application. And this study, so we decided to study healthy subjects to explore and better define the readiness potential preceding intentional eye blinks. And what we found preliminarily is that this potential is present before in the activity preceding a voluntary eye blink, two types, but it's absent in the brain activity preceding the spontaneous ones. So now we have to go to the patient's bedside and to see if we can do that. So, thank you. Bye.